Thanks, Stephen, for that great welcome. I would say that I was probably much better at spotting lions in 1990 than I am today. I have a hard time reading the newspaper. Maybe I'm better at distance. Maybe I'd still be okay with the lions. So welcome to Winnipeg. Here's a picture. You probably don't recognize this, those of you who visit. This is what Winnipeg looks like between winters. It's also what it looks like on a perfect night through the lens of a great photographer. But I'm happy to be back in Winnipeg because the last 3 weeks, my last 3 weeks were in temperatures of 40 plus. So this is much better than that. I have no specific relationships or conflicts of interest to disclose. So when I was thinking about preparing this talk, I was asked to give a plenary in the epidemiology and public health sciences area. I have, obviously, as an epidemiologist, I have lots of material I'd like to share about that. But I think, as Stephen said, one of the areas that I think has been too often neglected when we're talking about the public health approaches to HIV prevention is the whole area of community mobilization and structural interventions. And I think that this has been too long neglected, not only by researchers, but also by policymakers and program implementers. There's lots of very good reasons why we should be focusing more attention on these areas. If you look at Karnataka, India, which we've done, where I lived for a number of years and where we have a lot of work, about 26% of sex workers report being raped in the last 1 year. That translates to about 25,000 or 30,000 women being raped within a year within one state in India. And over 25% report violence from an intimate partner, husband or lover, every 6 months. So these are really important areas that we can't ignore, whether we be in public health or community mobilization or in social welfare. It's also been estimated that the elimination of sexual violence alone could avert 17 to 20% of HIV infections in sex workers and clients globally. So if we're looking at it purely through the utilitarian benefits of HIV prevention, there's good reasons that we should be focusing on these areas. Decriminalization of sex work could avert 33 to 46% of HIV infections through its effects on violence, police harassment, and the development of safer work environments for sex workers. And community empowerment-based HIV programs have been significantly associated with increased condom use and reductions in HIV and other sexually transmitted infections globally. So there's plenty of evidence. There's enough reasons why we should be focusing on these areas. But before I launch into a discussion of these areas, I need to share what my perspectives are and share with you disclaimers. First of all, I don't consider myself at all an expert in community mobilization. Most of my experience is informed by programs for female sex workers in Asia and Africa, and I think there may be only tenuous relationships to the situation in Canada and North America and Europe. My approach is mostly applied and programmatic, which translates to something that's largely atheoretical. And I know that there are people who do a lot of very good theoretical work in this field. And my interest in this area is really motivated by a few observations. First of all, though, as I've tried to point out, this is a highly important area. Community mobilization and structural interventions are really too seldom accorded sufficient attention in HIV prevention research. There's an increasing amount of this, but it really has not received the attention it needs and deserves. We seldom see the really good analytical and even theoretical frameworks substantially operationalized in practice. So there's lots of good writing about why and how to address structural issues, but we seldom see them operationalized. And this is usually because there's really severe resource constraints. It's very difficult to get funding to support these areas of endeavor. And I think there's a failure or a reluctance to articulate and measure program activities by those who are engaged in these programs. And I think that this often consigns them to a low priority for funding, implementation, and research. So, as I noted, I think there's an increasing amount of focus on structural interventions and community mobilization in the discourse around program strategies. This is a figure that's taken from a recent global normative guidance on sex worker interventions. And you can see I've circled in the top right-hand corner that community mobilization and structural interventions is identified as one of three sort of underlying or underpinning components of an effective and comprehensive program for female sex workers. So it is being recognized now as a core component of programs as we go forward, moving beyond strictly biomedical and behavioral interventions. But what do we mean by structural interventions? And when you dive into the literature here, it becomes a little bit murky. So there have been definitions. Here's a definition by a group from CDC in the US, where they define structural interventions in HIV as HIV preventive interventions that include physical, social, cultural, organizational, community, economic, local, and legal and policy factors. Really not much left out there when you think about it, other than maybe behavioral interventions or individual level interventions. But it doesn't really take you very far in trying to understand how you would articulate what your structural intervention is going to be when you're trying to mobilize resources for it. We can get a little bit more specific. We could look at structural interventions from different levels. So at a macro structural level, this could be interventions that try to affect the social and political environment that leads to stigma, discrimination, and inadequate protection of rights, or the illegal environment, more specifically, including areas like the criminalization of sex work, or even the economic environment around programs and social welfare programs. We could go a little bit lower down to the mesostructural area, looking at programs that directly affect violence and harassment, look at the venue or environmental constraints, or look even at the insufficiency or inappropriateness of different types of programs and services. So there's different domains within which structural interventions can be operationalized. Now, there have been some formal attempts to try to get communities of practitioners and community members to come together to look at the concept of structural interventions, and this is an effort that was made several years ago, and they tried to look at what were the concepts around structural interventions. And I must say that when I looked at this and when I read through this work, it didn't clarify much for me. And if I just take, for instance, the area of community building, here are the examples that were cited as structural interventions around community building within that analysis. So it included support for cooperative organizations of sex workers and active drug users. I understood that. Mandatory school-based HIV/STD education. Don't know how that fits with others. Housing for persons living with HIV. Funding community building and gay community. In the gay community, particularly in low prevalence areas, to reduce emigration. And then require all HIV prevention researchers to complete a 2-year internship in a community-based AIDS service organization. So these were all cited as community building components of structural interventions. Once again, there's a lot of confusion, I think, that comes out of this kind of an analysis where people are trying to think about and trying to define what a structural intervention means to them. And I think that this lack of clarity has really constrained our approaches. If we look at community mobilization, I think that this concept is a little bit more clear when you approach the literature. It's been defined as designed to engage and galvanize community members to take action towards achieving a common goal, which has a number of key components. That is building shared concern, critical consciousness, strengthening and building organizational structures and leadership, mobilizing collective activities and actions, and building social cohesion. So this is a little bit of a clearer construct for me, and I think community mobilization in HIV is probably drawing a lot on community mobilization concepts and literature from outside the HIV area particularly. But when I was thinking this through, I think it's important for us to try to look at the distinctions between and the relationships between structural interventions and community mobilization. And this is my very meager way of trying to do that. So if I think about structural interventions, it's really about addressing the disempowering social context directly. So it's trying to look at what is it within the social context that's disempowering for communities, directly trying to redress power imbalances and social exclusion, and improving the social, physical, and policy environments. When I think about community mobilization, it's really around deliberate efforts to foster shared concern and consciousness in a community, and to empower individuals and communities to contend with and transform the structural factors. So in a way, community mobilization is around strengthening the community to address structural factors and to participate in structural interventions, where structural interventions are there to address directly some of the structural barriers that need to be addressed. Now I'm going to take some of these concepts forward with a case study, and I'm going to take this as a case study focused on sex workers in South India, because I think that over the years, both deliberately and many times sort of post hoc, I think we've learned a lot about how structural interventions and community mobilization can be operationalized at scale, and why they're important, and perhaps what we need to learn from these kinds of experiences. So if we look at the context in Karnataka state, we were operationalizing this within the context of a very large program, more than 50,000 sex workers at more than 2,000 different spots and locations across the state. At the time that this program began, more than 80% of sex workers were street-based. In other words, they were working in public spaces, which meant that they were quite fragmented. They often didn't know many sex workers other than those that they worked nearby within a very local context, and so it was a very fragmented community across the state. When we looked at the HIV programs, the coverage was confined to really 2 or 3 districts, reaching a small proportion of sex workers within each district. And there had been attempts to support sex worker collectives across the state, but the membership was really very low, and the resources were extremely limited. So it was not a very comprehensive endeavor, though a good start. And when we considered putting together a program around community mobilization and structural interventions, one of the first things that we did was we recognized we needed to understand and we needed to engage the community to try to define what were the structural factors and barriers, and what were the community mobilization needs that would help to shape the kinds of interventions that we needed to look at. And we looked at it from 2 main lenses. One was to look at the power dynamics. What were the unequal power relationships that sex workers were facing within their intimate relationships, but also with the broader community? And also, in what ways were they being socially excluded, and how did these contribute to their vulnerability? And a couple of members of our team who didn't come from an HIV background at all started the process by having a series of very, very comprehensive workshops where they engaged with communities of sex workers in all of the different districts to try to workshop through what the power dynamic issues were and what kinds of issues related to social exclusion were affecting them. And what they realized was that you couldn't run these workshops in many of the ways that we would normally run workshops, because people were reluctant to speak. They didn't often know the other women who were within the workshops. Most of them were illiterate. More than 90% of them were illiterate, so printed material didn't really help. And so the facilitators of the workshops got them to narrate their stories through pictures, through skits, through stories and other kinds of things, and then use that as a way of trying to codify some of the power dynamics and social exclusion that they were facing. And this is just an example of one of the pictures that one of the women wrote in one of the workshops, which she then was able to describe and articulate what this meant to her, what it meant to be a sex worker, and what were some of the constraints and issues that she faced. Everything from the economic dependence that her family had on her, to the difficulty she had with clients or police and others, and also her aspirations. So some of the themes that emerged out of this exercise, which took really several months, was a number of themes related to these structural factors that led to a disempowering social context. So one of the themes that emerged very quickly was the whole issue of stigma and discrimination. Sex workers felt highly marginalized within their families, and within their communities, and in society more broadly. They felt that there was a very negative prevailing social attitude towards sex workers, which had been amplified by the HIV epidemic, where they were now being seen as being a risk to the community because of, through HIV. And they had high levels of internalized stigma, which reflected itself in feelings that they really didn't deserve the same kinds of social entitlements or legal protections that others did. And so there was a lot of internalized stigma that was shared and surfaced through this process. They faced a tremendous amount of violence and harassment from clients, from their intimate partners, and from police and from others within the society. And this often constrained their ability to protect themselves through the use of condoms, and kept them from accessing health services more generally. And they had a real lack of economic and social supports. So they didn't have control over financial resources. Most of them didn't have bank accounts, or they couldn't get a bank account, so they couldn't save money. And they were excluded, often systematically excluded from social entitlement programs, including the ability to get their children into schools. So through this process, what we did as a program was we tried to think about what could we do on the structural intervention side, and what could we do on the community mobilization side to try to address some of these emerging issues. And so on the structural sides, the structural interventions were really designed around dealing with the issues of stigma and discrimination, violence and harassment, and the social and economic exclusion. And on the community mobilization side, we articulated this through looking at the context of empowerment and the whole issue of power, which was a construct that wasn't specific to HIV, but something that had been very, very prevalent within social mobilization movements within India. So looking at the empowerment domains of increasing the power within, self-esteem and capabilities within, power with others through collectivization, collective consciousness and action, and power over resources, skills, building skills, allowing them to do savings, allowing them access to loans, etc. So those are the two kinds of areas that we looked at from the structural side and from community mobilization side. And this is actually a diagram of a phased approach to structural interventions and community mobilization. And I really wish that I could say that we drew this diagram up before the program started, because it would look like we had really planned all of this out. But this is actually a post hoc analysis of how the program emerged. And that's, I guess, how a lot of programs proceed, is that you do one thing after the other, and afterwards you sort of say, oh, well, how did we do this? So this was actually a diagram that was developed by a colleague at the London School, who analyzed all of the different programs that we had and looked at what was happening and talked to a lot of the people within our programs to try to understand how this had been put together. So in the early phases, we really were focusing on mobilizing as many sex workers as possible. The idea was to try to leave no sex workers unreached and uninvolved in the collective programs. The existing collectives that were there often had 20 or 30 women involved in them, when we knew that there were 2,000 or 3,000 sex workers within the city or within the district. And so the first challenge was really to make sure that all of the women were able to participate and build that cohesiveness and that collective approach. And this included a very, very large peer outreach initiative, building safe spaces, drop-in centers, and community-friendly services. So there was a place for sex workers to actually get together and meet, which was too often not available at all. And then systematically trying to do networking. So trying to build networks that started with the peer educators but moved beyond that, so that when there was a community event or when there were community challenges, there was a networking process so that they could come together and find solutions. Beyond that, in the subsequent couple of years, we really started focusing on interventions to look at the key structural factors. So trying to directly address some of the things that they were facing beyond their community that was really constraining them and disempowering them. So we focused on the police to develop a very large-scale program to train the police and engage the police to try to look at how they could be more positive factors in the lives of sex workers and the HIV response. We built crisis response systems so that there was a almost immediate responsiveness if a sex worker was in crisis. This included a hotline so that 24 hours a day, if there was a crisis, a sex worker could phone, and this included legal support. So there was a lawyer available for sex workers in every district, in every city, so that if they were arrested, they could call a lawyer to support them and bail them out of jail. There was initiatives for better access to social entitlements, media training, and advocacy for reducing stigma, and I'll talk about a little bit of these. And then what we also did was, over time, as the sex worker organizations became more and more, have more and more capacity and more leadership, we focused on trying to transition the actual management of the program and the leadership of the program to sex worker organizations, and I'll touch on that later. So as I said, the first challenge was really this community fragmentation and poor outreach, and we really intensified peer outreach and education to the extent that we had more than 1,000 peer educators across the district, and each of them had responsibility for about 40 or 50 women. And so this was a network of peer educators that we developed very early on. And you can see here, these are 4 peer educators who are actually now developing their peer outreach strategies. So they were looking at their town or their city or their village or their bus station where they worked to try to come up with a plan of how they were going to reach all of the women within their area. And you can see that we had very good and very quick results in terms of increasing contacts. So these are contacts. These are the number of women contacted by one of the peer educators. And you can see that starting early in the program, where about 10,000 sex workers had been contacted. By later in the program, we were regularly having contact with more than 50,000 sex workers. And one of the things that we noticed was that this increased contact with the women was translating into the number of women who were becoming members of community groups. So the peer educators were also setting up community groups, and you can see that over time, starting from a very low level, we found that over time about 60 to 80% of sex workers are now participating actively in community groups where they were able to share resources, share experiences, and also work together on collective actions. And here's an example of a sex worker convention that was organized in northern Karnataka, where sex workers came together from all of the surrounding districts to talk about what their issues were, what they wanted to advocate for, what social issues they wanted to address. And I think there was about 2,500 sex workers came to this convention, which would probably make it larger than any of the CAHR conferences, actually. And out of that process, the collectivization and building community-based organizations became a very organized activity. And so there were organized objectives for each collective, and there was an organized process to build the capacity of these organizations so that they could not only advocate for their rights and address stigma and discrimination, but also to start to manage programs directly. And I'll talk a little bit about that process. So here's the progress in development of the female sex worker collectives. You can see that one of the things that we've been tracking is not just the number of collectives that have been registered, but also the amount of resources that they have within their bank accounts or within their corpus. So you can see that the annual budget of these collectives in terms of managing programs has grown dramatically. By January of 2009, the collectives collectively were managing more than almost 30 million rupees of resources annually, and they had they were accumulating larger corpuses. Since then, this is substantially increased, I would say. And one of the other things that happened systematically was making sure that peers or peer educators were systematically moving into leadership roles within the organization. As you can see, that by January, more than 200 of the peer educators were now in more leading management positions within these collective organizations. And we found that engagement with community mobilization activities, particularly participation in collectives, was having an impact on some other aspects related more specifically to HIV prevention. So women who were who had high engagement with the community mobilization activities were 25 times more likely to have tested for HIV. They were 5 times more likely to have used a condom with their last client. They were almost 3 times more likely to use a condom with their regular partner, and they were half as likely to be infected with gonorrhea or chlamydia, which are more quickly affected by increased condom use and access to services. I mentioned before that we really saw that engaging with the police and reducing violence and harassment by police as a critical pathway to reducing the vulnerability of sex workers. And this was a program that I think is still unique. It was led by a member of our team who had joined us from a senior position within the government of Karnataka, and she personally led this process of what she called police sensitization. It was essentially training police officers in a unique way to try to get them to understand the lives of sex workers, how their actions could either harm or support sex workers. And the training program actually involved bringing together trainers who were policemen and sex workers. So there was a joint training team that had a sort of a senior police officer who was willing to become a master trainer, and he participated with a sex worker who was also part of a trainer, and they would go around and train police about HIV, about sex work, about the law, because many of the police officers didn't understand the law and the application of the law, and how they could play a more positive role. And what we found was that this was a very large-scale activity. Over the first couple of years, we trained almost 11,000 police officers, which represented about 53% of all police officers in the districts that we were working in. So it was a very large-scale activity. And we found that the training resulted in very substantial changes in the attitudes of police officers before and after the training. Now, obviously, there's some social desirability bias in these kind of questionnaires, but we found actually that there was substantial reductions in violence that sex workers experience. So this is over a 2-year period, 2 different ways of measuring this. But we found that there was about a 10% decline an absolute decline of 10% in the proportion of sex workers who reported being beaten or raped in the past year. And that magnitude of decline translates into about 6,000 or 7,000 fewer sex workers reporting that they've been beaten or raped in the last year. So it's a really substantial benefit, regardless of what impact it has on HIV. But we have found that violence is associated with higher risk for sex workers, so that those who report violence are half as likely to report consistent condom use. They're 30% less likely to have visited a program clinic, and they're twice as likely to be infected with gonorrhea. So you can see that the violence itself is directly associated with higher risk for HIV. Another program that we did was actually a very intensive program with the media, particularly the print media, which is the main component of the media and that people look at in this part of India. And what we found was that most of the stories about sex work had 2 characteristics. First, it talked about how it was morally wrong or that it was dangerous for people because of HIV. And the second thing we learned was that it almost never had the voice of sex workers in the story. So we actually got together media training programs, and each of the districts, we went to all of the local media, and we trained them. So sex workers would go with other journalists to train other journalists to talk about how this affected their lives, and also gave them opportunities to write stories that would actually include the voice of sex workers in it. And what we found was that the number of news reports that included quotes or stories from sex workers doubled, and the number of negative stories about sex workers reduced by about 40% through this initiative. Another area of structural intervention that we focused on was increasing access to social entitlements. This just gives some raw numbers, but there was a very fastidious program in all of the districts to try to get district AIDS committees to be responsible for making sure that sex workers who were entitled to these social welfare programs were having access to them. This could be everything from a ration card to a voter ID to getting access to housing loans, etc. Now I'm going to end with a few more sort of theoretical constructs in the sense that I think we can do better at trying to measure and articulate what our programs are meant to do and how we can measure their impact. So this is a framework, an analytical framework that was developed by the program to look at these issues of power, power within, power with others, and power over resources. And so we developed questionnaires to do routine surveys with sex workers to find out whether things were changing in these domains. And the idea is that if we could improve power within, power with others, and power over resources, we could start to address the disempowering social context, which included the power imbalances and the social inclusion. And ultimately, this would have an impact on HIV vulnerability, as we had seen. And I actually have this done twice, so I'm going to skip. So when we looked at the sex worker, the empowerment domains for sex workers, we defined power within as self-esteem and confidence to participate in meetings with other sex workers or health and social workers. There's other domains here. Power with was expressing the confidence and the ability to work together and support each other and the benefits of collectivization. And power over resources was represented by possession of things like social entitlements, including a bank account, voter ID cards, and ration cards. So we tried to articulate whether these were changing over time, and if so, whether those had a benefit in terms of HIV vulnerability. And this is a quick example of measuring these different domains of power. So on the left you can see power within, the center is power with others, and the right is supposed to be power over resources. I didn't have the right, I didn't put the right legend there. But what you can see is the three districts on the left, the three bars on the left are districts where there had been extensive community mobilization efforts. And you can see in those three districts, whether you looked at power within or power with others or power over resources, their mean power scores, which we had measured through these questionnaires, were all substantially higher than the two districts where there hadn't been substantial community mobilization activities and where a small proportion of sex workers were actually part of collectives. And what we found was that younger women scored lower in all empowerment domains. There was considerable district variation between districts with power in the different power domains, but generally districts with weaker community-based organization programs, the scores were lower. And the duration of time exposed to the program and the number of program contacts was actually positively associated with power within and power over and power with others in most of the districts. We also found that power within was associated with greater self-efficacy for condom use with regular partners and higher service utilization in all districts. And power with others was associated with greater autonomy, reduced reported violence, and increased self-efficacy for service utilization in 3 districts, and with self-efficacy for condom use in all of the districts. So I'm going to conclude by saying that I think we now have evidence, strong evidence, that community mobilization and structural interventions are effective and that they can be implemented at scale. I think that funding really has to be enhanced to close both the coverage and the scope gaps within programs. What I mean by that is that we don't need to just reach more communities, but we need to make sure that our programs are comprehensive enough. We were given the latitude to have really high-scale structural interventions with the police, with the media, with social entitlement programs, but that takes resources. and it takes funders that are willing to see those as important. And so I think we need to be able to advocate more effectively for that. It means we need to be clear about what we're trying to do. It needs to be clear about how we're going to measure our results. And I also think that the scope for funding has to really include community mobilization activities. If we're not providing safe spaces for sex workers to get together, then we don't have a comprehensive program. If we're not getting funding for those kinds of activities, then we have programs that they don't have the right scope. I think we really need to be strong in our advocacy for those areas. And I also think that our research has to engage and be iterative within these programs. They need to be iterative, they need to be program relevant, but wherever possible, they need to be community-led. And I didn't emphasize this in my talk, but the programs in South India have been very, very strong at getting community members as researchers, community members to lead the research, to be the researchers, and also to be engaged in mobilizing the knowledge for their own community, but also in their advocacy for the wider community. I'd like to acknowledge all of the people who've been involved in this work. First and foremost, the sex worker communities in Karnataka and their community-based organizations. The two NGOs that we've established and work with extensively, and some of the key people on the community mobilization side, Mohan Vandana, Paranita Shahji, and Ravi Prakash, who's done a lot of the analysis. And colleagues at the University of Manitoba, particularly Stephen Moses, Ramesh, and my daughter, who did a lot of the work on empowerment domains, and I need to give her credit now and again. So thank you for your attention, and I don't know if we have time for questions, but I'd certainly be happy to answer them. Thank you. I'm told we have a few minutes for questions. There's at least one over here.
Is it my turn? Okay. Hi.
Oh, sorry, is that me? Thank you. That was a really interesting talk. I wonder if you collected any information in the Karnataka work on the effect of your work on the sex workers' children, whether it be health or well-being or education.
Yeah. There's actually, particularly in northern Karnataka, there's a very large ongoing programs that really are not HIV focused, but they're focused on the children of sex workers. This was something that was of tremendous importance to the sex workers. And so there's programs that are led by a number of different funding organizations to look at ways of particularly focusing on strategies and supports to help them stay in school, and then also to support adolescent girls through from about the age of 11 or 12 through their teen years. So there's substantial programs there. What we found is that those programs have been very effective at keeping them in school, and we're actually in the process of a study now to look at the wider benefits of the programs for the children. We did find directly that the programs resulted in a much higher proportion of sex workers' children getting into school, which was one of the major concerns that they had. And there was sometimes it was small bureaucratic issues. Like if you didn't have the husband's name, you couldn't get your child registered in school. So very basic, bureaucratic interventions needed to be done to ensure that they could have their children in school.
Hi. I have a question. I'm here.
Oh, hi. Yeah.
So I have two questions, really. I'm wondering why you chose to come present this today and not a sex worker. This echoes a lot of what we've been doing in community-based organizations for the past 30 years. This is knowledge that we have and that we should be the ones bringing to the public. So I would like to know why you chose to come here and not bring instead someone from those organizations to do this presentation. And maybe I would like to ask the audience why you need to hear this information from one of your colleagues instead of from actual sex workers? And my second question would be the peer outreach workers that you mentioned. How much were they paid, and were they paid at a comparable level to the researchers that were working on this project?
So for your first question, I think it's a good question. I was invited to give this talk. I presented information that I thought was important. This work has been presented by sex workers from Karnataka all over the world, including in Montreal a few years ago. So we do try to make many opportunities, and I do agree that sex workers should be presenting this information, and they do present this information. The first time this work was presented to our funder, it was presented by sex workers in India to Bill and Melinda Gates. When they came, it was presented by sex workers. The payment for peer educators, the community researchers are paid the same as other researchers within the context. So we don't have a different pay scale for the community researchers versus other researchers in the community, and we try to keep that parity. Thank you.
Hi, good morning. Thank you very much for your presentation. The old hat that I used to wear before I moved to Canada was for UNFPA in the Caribbean. And UNFPA within the UN system was the lead organization working with sex workers. So we did exactly the same work that you've identified there in the Caribbean, establishing the Caribbean Sex Work Coalition, etc. So I was just wondering, in terms of the work that you did in India, whether there were any partnerships with whether local funders or international funders like UNFPA, like Population Services International, and other bodies that do similar work to avoid sort of duplication or even encourage synergies within the community?
It's a good question. I have to be a bit delicate in my response. There had been UN-led programs in India, but they were very small scale. It was a pocket here, a pocket there. I think that's too typical of programs where they just really don't get to the kind of scale. So you have, as I said, there were lots of collectives when we started. Some of them had been supported by the UN, others by bilateral donors, but they were relatively small in scale. So I think what we're really missing is something that really takes things to scale. Now, I think one of the initiatives that we've tried to support, and has been supported by a number of different types of funders, including the UN system, is to try to make sure that sex workers from different countries are able to get together. It doesn't matter whether the program people get together, but it's more important that communities get together. So there's been quite a bit of exchange whereby sex workers and sex worker organizations who've been leading this work in India are now interacting with those in Kenya or in other parts of Africa. So I think there's more and more of that kind of an interchange that's happening. I think it has to happen more frequently. There's even been attempts, I think, to try to look at even developing better video conferencing facilities between contexts so that sex worker organizations in different places can connect. But I think that part of my concern is that there's just a lot of fragmentation. Donors are fragmented. A lot of donors don't see this as important work, so it doesn't get funded. UN organizations, I think they may fund it for a while, but who sustains it? If it's not really taken over by local funding, it doesn't get sustained, and so I think there's a lot of work we still need to do. Oliviana. There's somebody here.
Thank you, Jamie. And I really wanted to thank you. I think a couple of points have already been made, but I wanted to thank you for doing such an excellent job of demonstrating the kinds of outputs that we can look at when we're looking at structural interventions. And I think that the kind of things that you've documented will actually help to obtain funding for sustaining programs and rolling these out. So I had some questions about, where the funding came to be able to do something as comprehensive as you did do over the years.
So the initial funding for this project was from the Gates Foundation, and I think it wasn't really part of the initial design of the project, I have to say, and I think that a lot of it was because they were a very responsive donor, and as much as anything, the communities were able to convince them that this was important and they needed to put resources into it. I think other funders are now seeing the importance of putting more resources into areas that focus on structural interventions and violence reduction. But generally, there's sort of a calamitous decline in funding available for programs generally. And I think that there's still a lot of work that needs to be done. In India, I think there's been, particularly at the state level, a number of state governments that support this. All of the interventions for sex workers in Karnataka are now being implemented by sex worker organizations. Every bit of it, all of the directorships. So every single program is now being implemented by a sex worker organization. And I think that's a remarkable testament to the fact that the government has made the decision to put the power and put the resources into sex worker organizations themselves. But I would say that's the exception, not the rule. And I think that those of us who have a voice, who may be able to influence funders, have to articulate that this is the right way to do things. This is a necessary way to do things, and this is the just way of doing things.
Hi, thanks, Jamie. That was a great talk. The one thing that I struggle with, as far as whether it's sex workers or drug use community, is this is a very transient population in some respects, and to build the community around activities that are generally viewed as not the best thing these people can be doing in the first place, and without being judgmental at all, how do we kind of balance that? Because when we try to mobilize a community, certainly the idea is for a drug user community that you shouldn't be doing this, and how can we move you on to something else? And I guess my question is, of all those lot of women, did many stop doing sex work, or how do you frame that?
Well, I think I think the first thing is that our role is not. We didn't see our role, and we still don't see our role as making judgments or assessments around what people are doing. That's not. So I think we were very, very deliberate in making sure, but it takes a lot of time to build the trust that you're not there in sort of a perspective of judging or trying to move people on to other occupations. So that we were very, very deliberate in saying that the role here, and we don't see one of the objectives as being moving women out of sex work. That was very, very clear. In fact, there's such a strong sense of self-stigma that I think if you have anybody within your program that has that perspective, it starts to erode any positive responses. So I think it's really, I think it's counterproductive. I think it's unnecessary. I think that we don't really focus on that kind of moving out of the occupation. There are women who wanted to move out of sex work, and they did move out of sex work with the support of the program, but was never a focus of the program, and I don't think it can be the focus of an effective program. Having said that, I think there are real challenges in different contexts where trying to have an organization of sex workers becomes very, very difficult practicably. So I just came back from Pakistan. It would be very difficult to have a sex worker organization or a sex worker collective that could have any kind of a voice, or even specific services because of the ambient social and cultural and religious environment. And so there, really what's happened in places like Lahore and Karachi, it's really women who are lower socioeconomic status who get together and they collectivize, and some of them are sex workers and some of them are others, and they get together and they don't. It's not labeled as a sex worker organization, but it's labeled as a women's organization, and they have women who get together. And I think it has to be done appropriately, but I think that it really undermines community mobilization efforts if the perspective is that we need to you know, what we really need to do is stop sex work, or we need to stop women from being in sex work, or we need to stop, you know, we need to move drug users out. Because I think if that's the perspective, then you really are not able to be partners with those communities.
Thanks, Jamie. Here's a gift on behalf of CAHR. And thanks very much again, Jamie, for a great talk. So that brings it to an end. The plenary sessions. There's about a half an hour now for viewing the poster presentations, and then the next oral section started at 11. Thanks very much for all for your attention.